Good evening, everyone. Welcome to PRISM Talks by Chennai Liver Foundation. I'm Dr. Vivek Shanmugam. I'm a transplant surgeon. I'm a managing trustee of Chennai Liver Foundation. CLF is an NGO based out of Chennai, and they do a fair bit of work in the community and in research aspects with respect to the liver. We just conducted the first ever Indian Hepatitis Summit in close collaboration with the World Hepatitis Alliance, and we work very closely with the ICMR and various other research projects. So we thought we should start PRISM Talks, which is Progress in Research, Innovation, Science, and Medicine. These talks aim to create an engaging platform where medical professionals, researchers, even patients, caregivers, and the public can come together to share knowledge, experiences, and advancements in not only liver disease, but also science and medicine in general. So what we thought was we'll do this as a monthly affair where we will bring speakers from across the globe who are pioneers in the respective fields and give you a chance to interact with them personally. We'll also use this platform to discuss and deliberate important issues. For example, viral hepatitis, which is our core. And of course, viral hepatitis, as you know, has to be eliminated by the year 2030. There's a huge ongoing vaccine shortage, which also we will be discussing in our monthly webinars. So we'd encourage a dialogue between the medical community and the public to spread awareness, reduce stigma about various conditions. We also want to promote awareness, bridge the gap between medical advances, patient understanding, and to inspire collaboration for various projects and for research, and of course, help the community in whatever way we can. So with that, I'm going to welcome my father, Dr. R.P. Shanmugam, who is the founder of Chennai Liver Foundation and a renowned gastroenterologist from Chennai. Can you say a few words, please? Oh, you're muted.
Good evening, ladies and gentlemen. I'm very happy to welcome you all for this first webinar of this kind from our side on behalf of Chennai Liver Foundation. And I'm very glad that the first speaker on this day is Dr. Ganesh, a close friend of ours, as a senior scientist in ICMR. And he has been collaborating with us for quite some time to propagate the message of liver diseases, especially viral hepatitis. And he is helping us in so many ways to promote this aspect either socially or scientifically and academically. He is one of the guides for us. I'm very happy to welcome Dr. Ganesh, and all of you can listen to him and learn a lot today on a very important topic of how to prepare a scientific paper. Very important thing, because publication is the most important thing. As Englishman says, publish or perish. So we'll have to start publishing and learn a lot from him. Thank you very much.
Thank you. So before I introduce Dr. Ganesh, a few housekeeping things. One is, of course, as you've noticed, all your mics would have been muted. So in case you have any questions, please use the Q&A button, which is next to the share button on the bottom of your Zoom screen. So please type in all your queries. All your queries will be answered as much as possible. We'll also put in an email address for you to reach out to us in case you have any further queries. We also encourage you to give us suggest topics, speakers, so that we might be able to engage with them and bring them onto this platform so that we can have a very meaningful discussion. So to introduce the speaker for the day, Dr. Ganeshkumar, a very, very good friend of ours, as my father said, we've been working with him for over 10 years now, is a scientist E and head of the Division of Non-Communicable Diseases at the ICMR Institute of Epidemiology, Chennai, Government of India. He's got about 15 years of experience in public health, research, training, and implementation. He has published over 100 publications in peer-reviewed journals. He has designed, conducted, and reported more than 25 internationally and nationally funded projects. He's been recognized as an emerging leader by the World Health Federation for the working in the area of prevention of cardiovascular deaths. And of course, if we talk about Ganesh, it'll be going on and on. So I'm going to stop here and let us do the talking. Dr. Ganesh, this floor is yours.
Thank you, Dr. Shanmugam and Dr. Vivek. And thanks Chennai Liver Foundation and as we this for our collaborative activity of between ECLF and ICMR NIE, the PRISM talks. Today we will be discussing about the topic on the art of writing award-winning grants. Thanks for this wonderful introduction. We being a researcher, in order to take it forward is in order to do a lot of research work, generate credible scientific evidence, we need a huge amount of support. Of course, research is resource intensive and definitely we need a huge amount of resource and support, which is naturally the grants available through many funding agencies. Currently, not all the proposals, of course, all the proposals have a great intention that really to answer an important question, which is there in the investigator's mind, or it is an organizational work, or it is a clinical work done by a clinician. But apparently, not all those research proposals reach out towards the funding. So naturally, this particular question comes, be you are an early researcher or a mid-career researcher, or even a seasoned researcher, what actually makes these grants as an award-winning grants? Whether your proposals could reach the life cycle of winning that particular grant, and eventually you could design well, conduct well, and report and generate an evidence. As being a researcher and as well as part of an funding agency, Indian Council of Medical Research, I have been positioned in terms of like reviewing a lot of proposals, as well as in the project selection committee. We've been looking into the grants credibility, the scientific rigor, and many other factors. Today, I will be sharing you some of the important learnings. Both I have been in a place as a researcher who has written grants, written proposals to get grants. And the other side is that as a reviewer, what all the research proposal should need to have. So let's start discussing about it. As said by Dr. Vivek, you can post your questions in the Q&A tool, which you are having in the Zoom next to the share button. When it comes to winning the grants, the most important thing is rejection is a rule, acceptance is an exception. Always, this is usually kept in the mind that the probability that a research proposal reaching towards winning a grant is less than 5%, which means out of 100 proposals being submitted, only 5 gets awarded the grant. What are all the reasons that the rest 95 didn't get and only the 5 could be able to excel well? This is the simple rule. The moment it get into the, it's very competitive. Awards, especially grants, are all very, very competitive. It comes through various levels of organizations, academic organization, a public health research organization. It could be a non-governmental organization, or it could be from an investigator associated with some medical institute or an institutes of national importance, whatever it is that. When the moment it reaches towards some funding agency, the reviewer starts putting a lot of filters and starts putting a lot of scans. The one thing they always keep in the mind, rejection is a rule. The moment when they see what particular proposal is exceptionally good, then only it reaches to the next stage. What goes on there? I'm just going to unveil some of those inside stories, that what matters for an acceptance, what are all the common mistakes in rejections. Of all the grants applications, how are these grants applications are submitted? There is a lot of evidence, and as well as based on my observation with my many fellow researchers, what I have seen is that majority of the grants are submitted just a week before the deadline, which means there is a lot of stress in terms of preparing the proposal, and last minute work happens. And that too, if you see here, less than 20% of the grants are submitted earlier. This clearly shows that a very well planned proposal, which has taken up a lot of time and inputs from their fellow colleagues and as well as the fellow researchers and from the entire team, was happening with only less than 20% of the proposals. Majority of the proposals are written in haste, and it is not properly planned, and that could be one most important reason that why many of those proposals are rejected. Moving ahead, if we just observe what are the commonest reasons of failure of grant applications, on discussion with many experts, on discussion with many reviewers, on discussion with the experts, and as well as those researchers who had successfully received grants, and those who have really seen the failure multiple times, these are the things have been emerged as the reasons. Number one, very poor planning. Because of the poor planning, we came to know about, yes, today is the last day of submission. Let us something we put into the proposal and submit it and see our luck. Then it is not a properly planned submission. It's a gamble. And deadline, most of the time, most of the proposals, when they start preparing at the late, and the researcher or the team get frustrated that they couldn't submit on deadline, so the deadline are not met. Second important reason is they don't follow the proposal guidelines. So proper planning is very important. When there is a call for proposals, there should be an adequate time to be gone through those call for proposal and see what are all the proposal guidelines. To be very frank and clear, funding agency diligently look into that your competency starts from there. Are you sticking to the proposal guidelines or not? If they say you need to summarize in 300 words, they look into that you are summarizing in 300 words, because rejection is the rule here. If they are expecting certain specific sections that has to come, they will be really expecting those specific sections are jolted down in your proposal. We are going to discuss further what are those parts and sections. Third important reason is that non-priority topics. The priority topics are clearly aligned with the national health policy, national health programs, or most important public health priorities, which is for the respective region or the country. And if you go closely look into the call for proposal, it's either aligned with any either of three of things. One is that country's priority. Number two is that the funding agency's clear-cut priorities. Or three, it's the most important a regional problem that needs to be addressed. The potential questions which needs to be addressed. That's why I said, again, we need to go through the call for proposal, and we need to understand what is the priority topics that particular call for proposal will fund, and what are those themes. And if they mention that following are the themes but not limited to, then definitely you don't have a liberty. You need to stick to that particular themes only, then you have a higher probability. You may try your luck by writing certain proposals which is not limited, if they mention not limited to the above themes, but majority of the time it is not considered. Fourth important reason, poor research question objectives, methods, and outcomes. This is the scientific rigor of the proposal. Your idea may be great idea. You may be thinking that every researcher, as I mentioned, everyone thinks that they are going to unveil the most important evidence for a key problem which they are thinking important in their life. But apparently, if you don't clearly jolt down the proper protocol which has the scientific rigor, then it will become a sloppy proposal. Then it falls back. To be very I am stating, rejection is the rule. And further, the most important rule is that the scientific rigor of the proposal. The fifth important thing is illogical frame and disconnected pieces. I have seen plenty of the proposals where the background is different, the rationale is different, the objectives are different, the methods are different, and the outcomes are totally different. This disconnected pieces in a proposal is really bad. This happens majority of the time when there is a poor planning and there is no diligent commitment from the investigator or the team. Or these pieces are written by different people and they just try to fit into one single proposal. This is also another important issue, an illogical frame of the proposal. It should be like kind of like an story and develops curiosity, similar like any kind of like an manuscript. All these pieces are should be connected. Why I need to do this, what I am going to do, and what I will find. These are the most important questions needs to be answered. And the last is that the lack of actionable outcomes. What your research outcome is going to answer a key potential question, which is an important public health program or a clinical priority. Is it going to improve the diagnosis of a specific disease? Is it going to cut down the turnaround time of identifying a key disease or an infection? Is it going to improve the therapeutics of a particular disease? Is it going to improve the delivery to make the last mile reach of a particular intervention? What is the most important piece that we are going to answer at the end of your proposal or end of your research? That is the actionable outcome. Majority of the time, exploratory proposals are not funded at all. They are expecting funding agency that exploratory research to be done within their own organizational resources. We'll move and start discussing. Okay, right. What are all the preparatory work that you are supposed to do when you are writing grants? To be very frank, your preparatory work starts the day which you are thinking you wanted to do a very important research. It starts there. Should not be driven by a funding call. You need to start discussing within your team, or you have to read a lot or review literature to identify the key topics, or based on your practice and experience, you will identify these are the important things which needs to be answered. And from that day, you need to start doing your prep work. Your call for funding may come anytime. Some of the most funding opportunities are perennial. It happens every year, sometimes annual. Sometimes it happens once in 3 years, but you need to keep yourself ready on that specific area. Number one, invest time on research ideas. How much time you need to do? At least you need to spend 1 month. What are the things you can do in that? Discuss, dialogue, do a literature review, and read a lot and try to see that. And also you can observe a lot in your practice and document it. These are all the potential research ideas. Prioritize those ideas and you need to brainstorm within your team. Without a team, there is no research. And this you need to take 1 month of this particular exercise to come down to say like 2 or 3 important research questions or ideas that you wanted to develop into a proposal. And finally, over a period of time, you will get to know that this is the one idea that which you are going to convert it into a proposal, and you will have a better confidence. Number 2, identify your research tribe. Find those people who have a similar kind of an rigor. Be a different type of an capacity. Some has to bring field experience, some has to bring on the table the statistical knowledge, some has to bring the design knowledge, some has to bring the operational part of it, and some has to bring the most important key subject matter. You need to have all these kind of different types of people, because Research per se requires a multidisciplinary team in its design, conduct, and reporting. Discuss among them at least 6 meetings before you convert your idea into a proposal. And that is the time that where you need to challenge yourself and be very honest. Third, look for a potential funding agency. This you need to start looking into that, which are all you need to start this exercise even a preparatory. You can start from as a public health researcher or a medical researcher, Indian Council of Medical Research. If you have a biotechnology research, you can look into DBT and welcome funds. If you have a kind of like an innovative scientific idea which is having a cross disciplinary way of doing it, then you can think of Department of Science and Technology. And there are multiple international funding agencies. It starts from, say, like there are 10 grand challenges call from Bill and Melinda Gates Bill Gates Foundation. And there are certain other international calls like Global Alliance for Chronic Disease. Look for the funding agency which actually is clearly you are linked with your subject matter. 4. Read the call for proposals once it announced. Even if you have identified the funding agency, you go to that particular funding agency's website and access those documents and try to understand that what are all the proposals they are potential to fund it. And that information is in the call for proposal. You need to read it at least 1 to 3 times, and or otherwise give it to 3 people and try to brainstorm that also. Next, be honest in answering the following questions. These are the simple questions which always I keep and ask myself again and again. 1, is this a very relevant research idea or a question that I can develop as a proposal? Is it really new or is it already been done widely? What I am bringing on table that this is new. Third, is it really feasible to conduct this research with your setting or in an Indian context or in your own context or in your institution or within your organizational capacity or among the team? Ask these 3 important questions and be honest again and again. Even if any one of these questions is no, rejection is the rule. Again, you go to the same kind of like in position. Your probability of your proposal not getting funded will be very less. Sorry, or not getting funded is very high. Moving ahead, what important compulsory parts of a grant protocol? This I'm coming to very specifics. These are all the 6 important parts which differs in different terminology among the grants, different funding agency, but all fits there as a mandatory items after I have reviewed it. All the grants, proposal and funding agencies, grants call for proposals demand these sections, which actually talks about your scientific rigor, your title summary, your problem statement and rationale, your objectives, what are the methods that you will be adopting in terms of answering those objectives, what is the team and the institutional capacity of the proposed work. Is it the first time you are doing or you have already done some amount of work previously? If that is also shown there, that gives a kind of like an higher credibility. And then the budget and detailed work plan. In my experience, I have seen that like majority of the time the people are looking into that is putting their minds on numbers on sample size and sampling, but majority of time is not happening on generating and research idea. And another most important piece where you need to brainstorm more and more, which is budget and detailed work plan, the sequence of activities. Let's look into that. What are all the protocol errors and tips on each of these parts? The most commonest errors, which I have also documented and seen is observed is for the title and summary. Majority time it is vague and it has too much of jargons. Lot of acronyms are there. Second, in rational, there is no or an irrelevant data. In rational, you need to justify it, why you are going to do this particular study. And it should be supported by a data, not by your own wish. Third, objectives. Most of the sloppy proposals which I observed have vague or over ambitious objectives, very vaguely written. The reader or the reviewer couldn't ascertain what actually this particular researcher wanted to really tell. And I have spent a lot of time on some of the proposals, and even we try to look into, say, like, we should, this is an important area, but we need to fund that, but it doesn't come out well as a proposal and scientific rigor. And as a methods, a lack of a design, a lack of a sample size, lack of an sampling, a lack of an analysis plan, commonest errors. Then as a team, you don't actually tell about that you have already done some amount of like an fundamental work on this particular area. That shows there is no team or a capacity share. And even if you are showing this is our study team and investigators, all are, say, like, if there is a study about one, say, about cardiovascular diseases, then all the study investigators are cardiologists. It doesn't make sense. Then where is a public health person? Where is an epidemiologist? Where is a statistician involved? Where is an other kind of like a multidisciplinary if there is a devices involved? So your team should be linked with the spectrum of your proposal which you are trying to tell. And finally, the budget is either overestimate or underestimate, or it is very unclear with that particular proposal. And what are the tips to improve is that for title and summary, you make it as very specific, very concise, and it should be impactful. Very specific means that it should know what is the measurement you are going to do, either it's on that particular subject matter, what is your study population, what actually is there in the time period that you wanted to conduct this particular study, and what actually is the place that where you are conducting study. We say very simply, there should be time, place, person has to be there. And it should be concise where the subject matter, and avoid jargons on the title. And in summary of the proposal is one maximum amount of time a reviewer looks into that. It should clearly links that impactful way in 300 words, how your objectives are converted into outcomes. Rational data points to study questions. It should have data points clearly linked to the study question. If your study question is about, say, like improving the control of hypertension, then your data point should not talk about again and again about prevalence, and or in terms of like an deaths due to cardiovascular diseases. It should clearly link to the data point for your study question. Objectives, it should be SMART. We are going to discuss more in detail what is a SMART, and it should align it to be methods. And in methods, the design, sampling, analysis plan should be explained very well. Team should have an expertise and share over the objectives. The expertise share is very, very important. And finally, there should be a clear-cut justification, and your budget should be balanced. Majority of the proposals where we have rejected, we have seen that majority of the budget has been invested on buying a lot of equipments. Then that brings a kind of a problem in terms of what is the capacity of that particular organization or institution, even don't have some basic instruments. Moving ahead, there are 10 important must-in methods. I'm not going to have too much of detailed discussion, but I'm going to jolt it down clearly. Number one, it should have a study design. Number two, you need to have a study setting and study population. And then you need to have a clear-cut study period from when to when. There should be a clear-cut operational definition. You need to have a study sampling procedure and sample size, and clear-cut about what are all the different tools that you will be using for your data collection. And there need to be an analysis plan where statistical methods are clearly explained. And finally, most important piece, majority of the researcher often misses that human ethics consideration if it is in human research. The success basics are the important 6 stars. What are the success basics? When we discussed among those researchers where they successfully get the grants, these are the things emerged. Number one, it's fit to call for a proposal where they are addressing to the appropriate funder. They don't send proposals to that particular funding agency where they don't fund such kind of a proposal. International funding agency requires an impactful proposal. At least it reaches close towards a regional level, if not national level. But obviously they'll be looking into a kind of like an huge geographical presence because they are investing huge amount of money for that. Impactful proposals they need. Second important point, scientifically finer. What it is that your study should, your proposal should clearly say that it is feasible with their organizational capacity and the setting you are going to do. It is innovative. It is having a novel idea. It is ethically correct in doing it and as well as relevant to the public health problem or a national health program it is trying to tell. Operationally, also, you need to tell in your proposal that it should be practical, rational, integrable, which is integrable means that you are not introducing some kind of parallel interventions. You are going to strengthen the existing interventions or accelerate a newer intervention. Unfortunately, a replaceable one often not actually been well encouraged. And you need to have clear cut measurable objectives. What are your clear cut outcomes? And jolt down with an operational definition. And it should be engaging. If you have a health system personnel, if you are writing a public health proposal, having a health system government investigators within your team is a great strength. Demonstrate competency of the study team. And if you have any kind of a previous publication and a research work done in the same area, it is a major strength. And finally, the institutional track record comes at the last way. It's not always that one particular institution, all institutions of national importance only get funding. We have been seeing that there are many other institutions which slowly develop their track record through publication and small projects and getting into large projects. These are all the key successful basics. I said already that the reviewers of the proposal always have a very quick mindset. What they do is that they usually look into these kind of questions. On immediately gone through the summary of it, they see that does the proposal solve a real public health issue, or it just a made up one, or it is a rare one? Is it a priority? Please understand that like majority of the funding calls are targeting to the key public health priorities or burning issues, and they want some kind of a solution towards it. These call for proposals are intentions to identify some of the solutions to that, and whether your proposal is getting into that or not. Number two, is it feasible with the resources and timeline? The resources includes the capacity of the investigators, it includes your organizational capacity, and as well as the geographical scope and the bandwidth which you are trying to put into your proposal, whether it is achievable in a timeline. 1 year study period and you are saying we will do a national level study of an intervention is totally, it's not unfeasible proposal. Third, does the team have a credibility or not? You need to look into the critically including who are all the people really bringing value on board. Please understand that reviewers really get into this. Okay, right? This is the most important issue. They are thinking about, say, like chronic kidney disease. Let me look into that. There is a nephrologist. Whether is there any previous work done by that particular nephrologist related to the, say, chronic kidney disease of unknown origin? Are there any publications? Are there any kind of like study reports that they have quoted? They will look into that. And that is an important credibility which is going to decide in a reviewer's mindset. And fourth important thing is that will this particular proposal lead to a new knowledge or a policy implication or a scalable product? As simple, it is called impact. Whether your proposal is going to get a kind of an impact or not. Is it a rate limiting step which you are going to answer it or not? These are the 4 important things in a reviewer who is going to review the proposal. Please understand that majority of the reviewers don't spend that much amount of time in reading through your proposal at length on each and every piece. They first look into these key issues. If these key 4 important questions has some interest, then only they will look into in detail about your proposal and they start reviewing it in more detail. If it is not going to answer any of these things, or it is going to be really a sloppy or unclear, then it is a problematic. So the most important takeaways for your pursuit in this grants is that number 1, know your funding agency. Very, very important. You should know your funding agency. Number 2, get asked why this to be funded now. You need to ask yourself, is it really to be funded now? The moment if you have start having a doubt, then it is a waste of time to submit it. Third, be in your proposal very humble, clear, simple communication. It's very, very important. showing off your expertise in terms of that we are the best team. Yes, we should be funded, and that kind of like an audacity, arrogance are easily picked by the reviewers. I have seen from topmost institutions many of the proposals gets easily rejected just because of that poor communication and kind of an audacity written on the proposals. Fourth, review internally and give adequate time to this. At least 1 month should be given to internally review on this proposal before the deadline and gain inputs from the team. Multiple times, at least 1 month. But what in majority of the other proposals that what we look into before we send to the funding agency, at least 3 months it gets discussed again and again between the team members. The final word from my side is that persistence pays, rejection is a rule, acceptance is an exception. So have persistence, revise, resubmit again and again. I stop here and hand it over to Dr. Vivek, and will be happy to answer majority of your questions. Thank you for this wonderful opportunity.
Thank you, Dr. Ganesh. That was wonderful, quite insightful into what goes into a proposal. We've already got a few questions coming in. There's one first comment from one Mr. Haraddeep Singh. What he's saying is that one is the stature of the organization to which they belong fetch them a grant in a comparatively easy manner. Do you think that's true?
It is true, but that is not the only criteria. The stature of the organization comes as the last. They first look into the proposal, then they look into the team's competency, and then they see that this is a reputed organization and we should fund. That's how it comes. So it's not always any proposal from a well-reputed organization, then it becomes a kind of a blindly they will accept, okay, fine, they can do it. No, it doesn't. To be very frank, if it is a well-reputed organization, then what they reviewers do is that they look into a very microscopic lens and see that did they write this proposal in depth, and this is not they set the bar very high for such organizations.
So he's also suggesting that the more important things are implementation, how the activities will be monitored for quality. And then, of course, he also adds that it's extremely relevant to add a detailed section in the grants on how the quality of the project activities will be monitored, quality of the staff will be ensured, and how they'll be trained and retrained.
So this shows there is one part of the proposal called quality assurance along with the implementation plan. You need to have one section. I didn't have a very detailed multiple other sections. There is a section called quality assurance where what are all the quality assurance methods that you have really considered in order to put it across. Is in terms of training, in terms of monitoring and supportive supervision visits, and as well as how frequently you are going to put the reports out.
There's one, the next question is from Dr. Surukesh Satyanarayanan. He says, if he's currently interested in a topic which is not worked earlier, will that be a single cause for rejection?
To be very frank, Dr. Sarukesh, the matter we are discussing here is that for a grant application. Now, this is the area that you are going to start exploring for the first time. What I would suggest is that do some of the reviews and start doing some kind of secondary research, start publishing on it, do some small scale studies within your setting and institution, publish it with your own institutional resources, have some kind of like a track record, and then you get into like, after I have done this much amount of work, now I have this research question which I wanted to address in a large scale. That is a large.
Dr. Ganesh, you're
This is
breaking.
the first time that you are going to do a research on this topic. Am I audible? Sorry, am I audible? I think I will just turn off my video for my bandwidth. I hope so. I should be audible and loud and clear now.
Better, yeah.
So what I am suggesting is that like you spend a lot of time on your previous work and then you submit for a good grant proposal.
Okay. The next question is Mr. Jayakumar Guruswamy, doctor, I think. Can MBBS doctor who's doing general practice in rural do research work?
Very, very interesting question. To be very frank, that please think in the mindset of a funding agency. A funding agency always look into the capacity of the organization, how they are going to handle the funds. Who is going to handle my funds? How they are going to execute it? What are these kind of like mechanisms they will put it across? Definitely, they have an alignment over the institution than an individual. It is better, my suggestion is that get yourself associated with some of the institution even as an adjunct faculty and submit the proposal.
I think that's a good point. Collaboration is the key, because if you're sitting in rural, you may not have access to statisticians and epidemiologists, and I think collaboration is the key. I think they have to reach out to other organizations, because I think data is there everywhere. You just need to put it in the right place, right? Right. One Nisha Dhanam has asked us, can a new researcher get the same preference for grants?
Of course, I will give one example. ICMR has a small grants scheme. In small grants scheme, they actually invite a lot of early researchers grants and encourage the early researchers to apply for small grants. Definitely now the ecosystem for grants has been very much improved. I suggest to explore those things. As well as there is something called seed grants. Seed grants are being provided by many funding organizations. These are all the grants where these are all called kickstart funding for your small work which you wanted to do and try to publish it and generate evidence of it, and which will help you to write bigger proposal.
Thank you. There's another question. How can researchers in Siddha medicine effectively address the dual challenges of creating evidence and preserving traditional medical knowledge when drafting grant proposals for funding?
I have a idea here. We have an Indian Council of Medical Research has one institution called National Institute of Traditional Medicine, and they are forming a networks of this integrative medicine, bringing the Indian systems of medicine and modern medicine researchers together. I suggest strongly to get collaborated with such kind of an initiatives from these institutions. And there are many research groups who actually brings this knowledge or try to generate evidence from these traditional medicine practices into the real world stream as the generating the evidence from through regular research.
Okay, thank you. And then Gayatri Mohan is asking us, what are some popular funding agencies for international publications?
I'm sorry, I didn't come across any kind of like a funding agency for the publications. Either you need to apply, you need to apply, you need to conduct a research through a well-funded grant which has in your budget item publications to be listed into it. But however, there are a lot of journals which actually waive off your publication fees if you have expressed the inability, and there are many credible journals which actually does not have any article processing charges. I think you should look into that. And there is one more called like in the open access in the policy, you could see you can restrict that. It may not be accessible for many, but still you cannot able to pay your APC, article processing charges, but still publish it. Elsevier publication, majority of them have, majority of the journals provide this opportunity.
Aranjit Singh is asking us, is the process blinded?
Completely blinded. At the final stage, where before they award the grant, there they will look into that, the institutional capacity and other things. Till that, I could bet on that whatever the funding review, the project review which I have did and been part of it, and as well as which I have coordinated, I have seen it's completely blinded, and the conflict of interest is been at the highest order.
So he feels that in apex organizations, people tend to use their influence to get grants. Do you think it's true?
It's assumption. There is no data backing that.
Right.
They have a higher probability because they invest a time lot, and they are all trained researchers. They invest a time a lot on writing proposals, and that's why they would have done a credible work previously, and they have those success ingredients in terms of investing a good amount of time in writing grants.
So Selvarani Gyanamuthu is asking, any proposal with multicentric involvement, clinical trials needing money, are these things matter to give funds?
Definitely. I don't know, Dr. Selvarani, you have looked into our recent funding call from Indian Council of Medical Research. We give grants up to 8 crores and we encourage multicentric studies. And I think you should look into the grant calls very specifically related to development proposals, which are called clinical trials. Definitely they get funded.
Rishabh Saini is asking us, in fact, thanking you and asking us, if the research topic is new and has not been previously studied, is it acceptable to seek guidance or collaboration from experts at other institutes?
You know, Dr. Rishabh, that is yes only. But provided that how you are executing this collaboration, it's a lot of people work and as well as a kind of conversation scientifically in order to make this handshake happen. Best wishes for your research.
Ganga Lakshmi Chokkalingam is asking us, communication gap is there from the apex organization to the institution. How to avoid it, sir?
I don't know, you are trying to tell the Apex organization as a funding organization. The communication gap which you are trying to tell is little vague and generic. I have trying to understand that currently majority of all the research funding organizations have a specific program officer and as well as the specific chief who looks into it. And for ICMR in our EPMS portal where we submit proposals for extramural grants, we have a feature called an help desk, namely Solution Clinic. And that is clearly monitored and the turnaround time is very much less. Nowadays, the communication gap has come down a lot.
Thank you. And then Nisha Dhanam is asking us another question. Without having any institutional support, can we get funding?
I think it's an internal matter that you need to sort it out. With your own institution, you need to gain support.
No, I think what they are trying to ask is, say there's a private practitioner.
Okay.
And he just wants to apply funding on his own. Is it possible? What are the options?
Now they need to collaborate with the institutions, or they get associated with some institution as an adjunct faculty or a part-time faculty and execute the grants through the institution of their area of interest. As a private practitioner, any individual may not get funded. The individual grants are only either travel grants or the career start grants are available for individual researchers. Those are all very minimal.
So Rama Rajesh is asking us, does the nurse-led interventions get funded when they are tested by group of nurses?
There is no difference as a nurse or doctor. A researcher is a researcher and it is vet on your proposal, scientific rigor, and the previous credible work, and of course, the institutional capacity and feasibility of executing it. That decides. It's not the profession or the designation matters here.
And Mr. Aramanathan is asking us, what is your suggestion on publishing protocol developing process?
So what my suggestion is that yes, protocols gets published. There are a lot of journals which publish protocols, which includes BMJ Open. There are many journals which publish protocols. But my suggestion is that you need to vet your protocol better, submit to a funding agency, get some reviews, and then later if it is not funded or funded, then you should publish it.
Fantastic. Another question is Ramajayam Govindan. All project needs biostatistics expert as a co-investigator.
If your proposal has a lot of statistical element and as well as modeling and sampling exercise, definitely it requires an biostatistician. They will look into that. If there is a complex sampling procedure and as well as a detailed statistical analysis, they will look into that. Do either there are two things. One is that you have a statistician, biostatistician in your team, or second, you have that capacity and you have published such kind of similar work previously.
Yeah, I think what we can also say from Chennai Liver Foundation's view is that we've been applying for funds for quite some time, and only after collaboration with major organizations, with the backing of major organizations, we are able to do achieve those fundings and get recognized. I think I feel collaboration is the key. I don't think we should be ashamed to ask for help, because there are lots of people who are willing to help, and of course I think anyone can and should apply for funding, because I believe there's a lot of money there for research activities. Correct, Dr. Ganesh?
I totally agree with you. The most important thing in research is collaboration. And you said it and clearly nailed to that point. Collaboration brings expertise, collaboration brings perspectives, collaboration brings resources, and collaboration brings lot of support and the future work. So without that, research has no meaning.
Someone's asking us, can you share your first funded project?
There are a lot of funded projects which has been published and it is available open. I think you should look into it. My suggestion is that the funded projects of Global Alliance of Chronic Diseases, GACD calls, are available open online. Funded projects of Gates Foundation are available open online. Many of the ICMR funded projects, investigators publish it. And there you can clearly search in PubMed that with the grant number as one of the filter, you will get those proposals which are all funded. I think that is a better way to learn and as well as adopt some of the practices.
I think what he meant was, what was your first funded project?
Sorry, I went. So my first competitive funded project is from an Indian research organization, and that was rejected nearly some 4 times, and I had to review it. And from the start of my career and the first funding, it took nearly 6 years, to be very frank. So only on the 6th year, after submitting some 6 proposals and revising one proposal for 4 times, I got a funding. My international funding is because of I had a good collaborators on board and lot of expertise from the government partners that strengthened the proposal. The impact which being an Indian Council of Medical Research scientist, the collaboration with the government and collaboration with many international agencies is the platform that we built, and the impact we create is towards the country level and national level, which actually brings a lot of scope and impact to the proposal to get it funding. But as it's not so easy to get that funding, we need to learn a lot and we need to accept our mistakes.
So Arunjit again is asking us, is there a repository of funding agencies? Interesting
question. You may please look into indiaalliance.org. There is a good repository is available, and as well as I suggest that currently with the advent of the information system, you can create your own repository if you spend a lot of time on internet. Just a 1 hour of or 30 minutes of research, you will get all the potential funding agencies. By Google search, by Perplexity, by many of the other tools, you get that very easily done.
Deepa Janikaraman is asking, for state government doctors, research takes a lot of time in addition to the regular work. So if in a government hospital, can a government assistant professor or professor can have honorarium benefits for the researcher in the funding proposal?
Very genuine and a fair question. There are certain funding agency which allow what actually, for example, it depends upon your organizational policy. Many international universities allow to take a part of their salaries from the proposals they write. For example, from my organization, Indian Council of Medical Research, it's not allowed to take any kind of like an honorarium or what I say like an income generated through that funding as part of our income. It's not allowed. It's an organizational policy. It's not about the funding part of it. So it's up to that your organizational policy allows, then it is. But I'm definitely very much sure all the state governments and the national governments, Indian government never allows to take out a kind of like an from your own research proposal to take out any amount of like an salary or income into it.
So government of Tamil Nadu does not allow that, correct?
Yes, of course, as of my knowledge, but they need to get clarified with their respective organization.
Joe Thomas is asking how to apply for CSR projects, how to narrow them down from net searching the company to the topic of our interest.
People work. CSR work matters about the people work. Dr. Vivek knows very well, better than me on that. It's about you need to know people, and then only it works. CSRs are all driven by people work is what the knowledge which I heard. Some of the CSRs reach out to potential organizations actively. I will give very clear examples like Indian Institute of Science Bengaluru. Many CSR, industries reach out to them and give funding voluntarily because they have the credibility they have built over years and as well as I think IAS is over centuries. So it depends there. I mean, but as an individual, as a starting point, you need to know really the people inside the organization to convince them that you will do that impactful work and it should be genuine.
So Arunjit is again asking us if he's a government doctor and he's employing staff on contract, can the project staff in my project receive salary?
We already answered that question. So for them, it's not, it's an organizational policy. But of course, project staffs are allowed in any proposal.
And another question from him is again, can I quote any relevant ICMR policy on the subject?
I don't know what actually is trying to tell in terms of ICMR's policies for the ICMR's the organizational, whether that particular investigator takes up the income. Is that the question they're asking, Dr. Vivek?
I think so. That's how I understood it as. Yeah.
Yeah, but we already discussed it. Yep.
Yeah. Gloria Justin is asking, what if any conflict of interest happened after the acceptance of a proposal or the funding agency stopped funding due to policy changes?
It's a call at the funding agency. It's a very special case scenario. But I have come across many of the funding has been stalled in between, and I mean stalled means like it's been stopped because of some misconduct of the research. I have come across a lot, and I have also come across that seen the misconduct of the research, and they have faced the consequences. But the conflict of interest part of it is a special case scenario. Most of those things never come out in public domain.
So I think Aranjit is asking us, sir, ICMR is a government organization, right? So I think that follow up of the question.
Okay.
So I think he's a government doctor, ICMR is a government organization, and you have contract staff for the project.
Yes.
Can salaries go into the project funding?
Yeah, the funding agency allows to, if they can clearly go to that, there is a published public domain available, the recruitment rules of the project staffs and their educational qualification and eligibility. And it's up to that the recipient agency is to be stick to that particular thing and ensure the disbursement of funds to the disbursement of salary is timely to the project staff.
Maheshwaran is asking us, can you share a few topic, title or concepts of proposal that impressed you recently?
So as I said that, like you could look into these 2, 3 repositories which I mentioned is that GACD, Gates Foundation, and published protocols. I think those are all very fair. It's all available in public domain. They could look into it. But we have received that question. If we will definitely, as part of the PRISM talks, we will send. We have all your email IDs. We'll send out a model proposal which has to be written, which is clearly written.
Another question from Kehran Rema, sorry. I'm a Siddha doctor who's doing MPH. I have 6 publications in Siddha and I've done 2 mini grant projects funded by CCRS. Now I'm jumping into a wider field with MPH. How can I highlight my previous work for international funding for my upcoming non-Siddha work?
You have answered it, you can't. So, but you can still put that in your proposal. That shows your previous experience of the research conduct and as well as handling the grants. And it also gives you the credibility. It has never been a negative. You can still quote it, but it's a discretion of the funding agency that the area which you are proposing and your previous publications, if it is unrelated and you cannot really highlight it, that this is what actually going to get linked with that. So it may also turn out to be negative to that, but it may definitely not a clear negative. But your previous publications and previous grant management is always a strength. I think we answered all the questions. Very interesting discussion.
It's interesting. Yes. It's about 1 hour almost. We've done, and we've. Oh, there's another question which just popped up. Just a minute. Ramya, Dr. Our good friend Abel Rajaratnam sir has said Ramya can link up with allopathic researchers and contribute. Yeah.
Okay.
Thank you very much, sir, for joining. So, Dr. Ganesh, can you just summarize just in 30 seconds?
So I will give a clear-cut summary in terms of it. What you need to really consider when you are going to write a proposal. Most important, don't do the mistakes which majority of the sloppy proposal do. Those mistakes are 3 important things which I will tell. Number 1, not following proposal guidelines. Number 2, very poorly written scientific rigor methods. Number 3, an illogical, non-actionable proposal. The most important 3 success mantras where actually a proposal may get higher probability of funding. I say 3 things. Number 1, finer, feasible, innovative, novel, ethical, and relevant. Number 2, prime, which is practical, rational, integrable, measurable, and engaging. And third important thing is have a very good team in your proposal. These are the important takeaways that I wanted to share with all of them.
Fantastic. Thank you, Dr. Ganesh. That was an amazing start to our first ever PRISM talks. I think still 1 or 2 questions are coming up, but I think we'll have to wind up for want of time. I think it's a solid 1 hour session. For those who have questions, please write to us at research@ChennaiLiverFoundation.org. We'll be more than happy to connect with Dr. Ganesh and answer your questions. These talks will go on to our YouTube page of Chennai Liver Foundation. So please follow our page and you should be able to see all these talks there getting stored. And of course, today we had close to 450 registrations for this talk, which is quite encouraging. So my request to all of you is to share that such a session is happening to begin with. Share the talks and share the links to the pages which will be emailed to you. If you have any suggestions at all, please do write to us about the topic and we'll be more than happy to get the most high-end speakers which we can have and present them in front of you. So Dr. Ganesh, thank you very much for this amazing session. We'll have to close this session and call it a day. Thank you very much indeed.
Thank you for the wonderful opportunity. Thank you, everyone.
Thank you.
Thank you, Chennai Liver Foundation.
Thank you. Bye-bye. Yeah.